Hi everyone, I'm Dr. Anisa Kapadia and I practice rheumatology in Mumbai. This is a short informative video talking about the impact of the COVID-19 or the coronavirus on patients with arthritis. So we all know about this virus as we have received a lot of information through WhatsApp and various social media along with the news. But just to summarize, the COVID-19 belongs to a group of viruses known as the coronaviruses. And the known ones, of course, are the MERS, the SARS, and the SARS-CoV-2. We know that the virus spreads from person to person via droplet infection, but also via fomites, which are inanimate objects which, when contaminated, can transmit the virus from one person to another. Some virologists estimate that the virus survives outside the body for as long as 48 to 72 hours. The symptoms vary quite a bit, and patients may be completely asymptomatic, as in they have no symptoms at all, or they may have mild symptoms just like a flu, such as fever, cough, or cold. This will account for almost 80% of the patients. However, some may have more severe or critical symptoms requiring admission to a hospital. The incubation period, or the time from infection to showing of symptoms, may vary from 1 to 14 days. A severe manifestation of the coronavirus infection may be pneumonia. This is where the infection enters the lungs and the air sacs in the lungs become inflamed or filled with fluid. This causes cough, but also it might make it difficult to breathe. So patients who have inflammatory arthritis such as rheumatoid, psoriatic, SLE, lupus, or vasculitis are prone to infections of all sorts. Their immune system, although overactive, has a poor ability to fight infection. Therefore, they may be susceptible to a more severe form of infections. Other health problems such as diabetes, blood pressure, heart problems, kidney problems, cancer, or lung diseases such as interstitial lung disease, obesity, may make you more susceptible to developing infection or a more serious form of it. Patients with arthritis are on various medications. If they are on steroids, this should be reduced to the minimal possible dose. Methotrexate, leflunomide, sulfasalazine, and hydroxychloroquine need not be stopped if there are no symptoms. However, if symptoms develop, then the doctor should be consulted immediately. For the newer injectable biologics, such as etanercept, infliximab, or adalimumab, or the newer molecules such as tofacitinib and baricitinib, again, you might consult your doctor, who will advise you depending upon your clinical situation. Recently, ibuprofen and naproxen and other such anti-inflammatory drugs have come under the scanner. There have been some reports of more serious cases or complications in patients who have used these drugs. These medicines should not be used for fever or sore throat. If possible, use paracetamol for managing pain. Avoid anti-inflammatories where possible. More data about this, however, is awaited. What can you do? Patients who have arthritis and no symptoms should try and shield themselves, that is, stay at home at all times, especially those who are extremely vulnerable. To define who is extremely vulnerable, the British Society of Rheumatology, the BSR, have come up with a self-reported questionnaire. You may score yourself depending upon what medications you are taking or have taken in the last few months. This will also depend on how old you are or whether you have any coexisting medical problems. Depending upon your score, you may then decide to the level of isolation that is required. Given the Indian scenario currently, it is best that we all stay indoors. If you have arthritis and you do develop symptoms, then you must consult your doctor, even if this is a telephonic conversation. Please do not self-medicate. Try and isolate if possible, if an admission to the hospital is not required. What we must all do: we must wash our hands with soap and water, at least for 20 seconds each time and as many times as we can. We should try and avoid touching our face, as the infection generally spreads via our hands to our face and therefore our airways. Try and eat healthy with adequate protein intake. Exercise. This helps to maintain muscle mass, which is always important in patients who have arthritis. Practice deep breathing exercises such as pranayam at home. This helps to improve your lung function and vital capacity. Keep your other medical problems such as diabetes, blood pressure in check. Cover your mouth and nose when sneezing and coughing and encourage others to do the same. Keep your distance, practice social distancing as far as possible. So when should you seek medical help? If you have a fever, cough, or trouble breathing and might have been exposed to a patient who has the virus, you must call a doctor. So, should you see a doctor? This may be needed if you have been exposed in the last 14 days to someone who has had the infection. That means you've been within 6 feet of that person, or if you have lived in or traveled to an area where lots of people have reported having the infection. A test may be needed depending on various factors such as your travel history, whether you work as a healthcare professional, and the severity of your symptoms. A chest X-ray or a CT scan may also be required. Mild symptoms such as a fever, a cold, or a cough may require only symptomatic treatment and antibiotics or antivirals if felt relevant. Isolation would be the most important thing. A moderate to severe infection will require hospitalization and testing. These are some useful links to gather more information about this. The most important information, however, is that we must all stay at home because prevention is better than cure. Thank you.